So we've talked about transverse plane. We've talked about full range of motion. We've talked about pronation, supination. So Cole and I were just talking and he brought up the point which leads us to muscle pennation. So if we look at muscles on an anatomical chart, we see that they run in diagonal patterns. So if I have Cole stand here, so about the only muscle that you're gonna see, you'll see long-headed bicep, and then you'll see lower extremity-wise, you'll see rectus fem. So rectus fem is going to basically run from there, ASIS to tibial tubercle, okay? Pretty much a straight line. But if you look at vastus lateralis, diagonal, medialis, diagonal, gluteus medius, pennation has got a fan pennation. Gluteus maximus is going to, go ahead and turn around. So gluteus maximus is going to run at different angles. If you look at the hamstrings run at angles. They don't run straight up and down. So if you are not giving your patients or your clients exercises that use the transverse plane, you're not using all of those muscles. So remember the demonstration that I did with Cole when he did an unloaded squat versus a loaded squat? His muscles function a lot better when they are loaded because you are making them work against resistance, especially with athletes that are used to having resistance. If you only make your patients or your clients work in a single plane, so if I only have him do lunges, I'm really only making rectus fem work as hard as it can. If I make him do crossover walk with the squat, now I'm getting the diagonal transverse plane component, which is making vastus lateralis work harder because I'm making it work harder. So remember, muscles are lazy. They're only going to work as hard as you make them work. So if you're only doing single plane exercises, you're not using all of that important muscle pennation to help kick in. So Cole is a basketball player. Even if he wants to go up and dunk from a double leg squat, he's still going to pronate in order to get as high as he can. So if I have him set up like he's going to take off for a jump, facing that way, go ahead and set up. Good, okay. He's still going to get pronation, so he's going to internally rotate at the hips and the knees and the feet, because that's going to load all of these muscles that run at diagonal patterns. If I had Cole do a vertical jump test and I let him jump the way he wants to jump and let him pronate, he's going to explode higher than if I told him, hey, I'm gonna put some inserts in your shoes that are gonna keep you out of pronation, and instead of taking off the way you want to with your knees in that position, I want you to take off with your knees kind of like bow-legged. So if I made him take off like that, now his vertical jump is not going to be that good. Why? Because he's not loading through the muscles that should be loading in an eccentrically pronated position. So take-home message is, if you are not prescribing, especially active dynamic warm-up and cool-down, that bias the transverse plane, aplanar motion, while they are loaded, going through a full range of motion, you are not getting as much function as you can get. And the more you let them go through a partial range of motion, unloaded, so cat, camel, clamshells, all the garbage, non-weight bearing exercises that conventional PTs do, those are not going to help them function. You need to be loaded. They need to go through a full range of motion. They need to have pronation, supination, aplanar motion, and a huge transverse plane component in order to use all of that pennation that's running in diagonal patterns. So make sure that when you watch what you are prescribing for your, especially for your athletes, but also for your Medicare patients or whoever else, that you are making them twist and turn, unload, load, explode, pronate, supinate through a full range of motion, total body exercise, not trying to break down individual joints, not trying to limit range of motion to go around pain, because if they have pain doing the exercises that you're giving them, that means you didn't do your job in reverse inhibition beforehand. So before I do all this, I'm going to break him down and make sure each individual is facilitated. If not, I'm going to facilitate it, then go to this step. So that's what you need to be thinking about as you're prescribing exercise, and hopefully you're prescribing dynamic, active, warm up and cool down, not passive stretching, not foam rolling, not all the garbage.